Hey, it's Dr. Kandula. I covered the obstructive sleep apnea versus central sleep apnea in a different segment. In this segment, really just going to break down obstructive sleep apnea. So as we've talked about, obstructive sleep apnea is a throat issue 100% of the time. And so to the issues that cause obstructive sleep apnea are always anatomic. It's how somebody's built in the back of the throat. So we talked about the nose previously. We talked about if somebody's got a nose problem, they've either got an anatomy problem or a problem with the lining on the inside of the nose. If somebody has sleep apnea, they do have an anatomy problem, period. Now, the anatomy could be compromised, meaning things are just tight back there, and or somebody could have extra weight on board, which makes the anatomy more compromised. But at the end of the day, it's really a plumbing issue back there. Now, why might somebody have sleep apnea? What kind of anatomy issues can cause somebody to not breathe properly at night? And it's really, if you think about the back of the throat as a circle, anywhere around that circle, you can have an issue. And so when we look in the back of the throat, just to orient those that aren't seeing patients on a day-to-day basis, when we look in the back of the throat, if you look to the sides, if somebody hasn't had their tonsils out, then what you'll see are two lumps of tissue to the sides of the throat. And so somebody could have issues with enlarged tonsils. That can get in their way, and that can happen. It is more common to be an issue with younger folks and kids especially than adults, but it can happen to anybody. So that can be an issue. So if you think about obstructive sleep apnea, the sides can be an issue. The top can be an issue. So when I say the top, I mean the palate and then the uvula. The uvula is the little punching bag up at the top of your throat. If you look back in the mirror, that palate area can be elongated or redundant, which means it's just floppy and getting in your way. The palate is another component. So tonsils to the side, palate to the top. The uvula is just an extension of the palate, so think about that in the same context. And then in the bottom of the circle, what's at the bottom of the circle? Your tongue. And so if somebody's tongue is too big for the size of the back of the throat, that can absolutely get in your way. And so those issues can be in isolation. Almost always they're in combination. So it's very, very common for somebody to have a large base of tongue, a redundant palate and uvula, potentially some enlarged tonsils. So any way you narrow that throat down can compromise you. And if it's one of those things, it can hurt you a little bit. If it's many of those things, it can hurt you a lot. If you are born genetically with a program to have a tight throat, you're destined potentially for some trouble. If you have genetics or don't have genetics that create a tight throat, if you add weight onto your body, you will narrow that throat down. So there are some folks who have sleep apnea because they're too heavy. There are some folks who have sleep apnea because their airway is too tight. There are many folks who are too heavy because their airway is tight and they never get a good night's sleep, and therefore they're always tired and always making poor choices during the day, which adds to weight gain, which that weight gain causes their airway to become more tight. You get the picture. So that's a really common scenario. And if you talk and look and interact with our patients, you'll see folks who, whose airway issues have put them in a downhill spiral. And our job is to try to identify the problem and get them out of that trouble. And so again, anatomically, my goal today is really break it down as simply as I can. And this isn't hard, and I hope everybody can remember that simple construct. So if you think about how somebody who has sleep apnea, and even if you're not seeing them as a patient, but you're just kind of looking at their chart, think about, okay, why might this patient have this? What's going on here? And know that it's that simple. If somebody has obstructive sleep apnea, it's one of those issues, might be a few of those issues. We'll talk in a later session about what are our treatment options. And there's a few different treatment options. The treatment options that we use are based on what we're seeing in the back of the throat. So if somebody's got a particular kind of tightness in the back of the throat, that's going to lead us in a particular direction as far as treating their issues. And of course, everybody at Advent knows if somebody's got a throat issue and a sleep apnea issue because of their throat issue, they're likely going to have a nose issue as well. And so you can try your might to treat somebody's throat issue with a nose that's not working, but instead of that, what we do here is we try to have somebody's nose on our side and their side versus against them as a starting point. And that really does make all the difference. So that's all I got. Till next time, we will talk again.